one, two, a one, two, three. Dr. Short, how are you, sir?
I'm doing well, Dr. Abe. How you doing, man?
It's such a pleasure seeing you. It's been a long time since we've actually seen each other in the three-dimensional world.
That's right. It's been a little while.
So, Rico, how's your practice? Is it open?
Yeah, practice is open, and we're running full speed can with all the social distancing and all the parameters we have to set in place due to the COVID situation. We're seeing patients and taking care of people and keeping them, out of the emergency room and hospital clinics.
How has COVID-19 affected your practice, your daily practice?
Well, COVID-19 is definitely slowed us down quite a bit. So unfortunately, we can't see as many patients. So it has affected the practice from that standpoint. Also, too, it's kind of affected our practice in a good way, in the sense that we can do a lot more one-visit endo because we can spend more time with the patients and complete it. So that's a plus, because patients don't have to come back for second visits if I don't have enough time due to my busy schedule. And also, too, there are some of the general dentists prefer us to go ahead and restore the case while the patient is there. That limits their exposure to possibly the COVID situation, and they don't have to schedule another appointment just to get a build up or things like that. Now again, I'm doing simple restorative cases. I'm not doing crowns or unlays, inlays, nothing like that. Just simple restorative procedures, just to make sure the patient is able to maintain their tooth until they can possibly get a crown if they need it, or to keep it from getting recontaminated if it's a long time before they can be referred back to their general dentist.
Now, do you have sufficient PPE?
Yes, we have sufficient PPE, and the reason is because I came back from my eye injury on March the 2nd. And so right when I came back, that's when all the COVID stuff started ramping up. So I was grabbing PPE, it's all these acronyms now, from everywhere. I got some from Amazon. Some of the stuff from Amazon was crap. I put on my shoe covers and my foot went right through it, and put on some of the surgical gowns, and it was like putting on, a paper that my kids used to color with. So that was an interesting journey through that. But eventually, we were one of the forerunners with it, so we were able to get our hands on some PPE stuff pretty quickly, where a lot of other dentists, unfortunately, they couldn't, and even endodontists, because frankly, a lot of people were afraid to, stay in practice and keep going. When for me, I was on the other end. I was just coming back from almost 7 months of being off due to a severe eye injury. And then, I really didn't have a choice. For me, it was sink or swim. So we decided to swim.
Are most dentists getting PPEs from your dental society, from the ADA, from the state? Are they supplying any supplies to dentists in Georgia?
Now we're starting to get some stuff from our state dental state organization, the Georgia Dental Association. It's not free. I mean, you have to pay for it, obviously, but at least they have access to some. It runs out so quickly, and some of the stuff, when the KN95 masks first came out, I got them from my organization, my state organization. Then I was like, man, why these fit so loose? And then they came out and say, hey, this isn't past the regulatory test. So all the ones that I bought was pretty much, not as good as what the level 3, the regular surgical mask. So they had to kind of figure that out, and they went back to the well and got some more. And then they kind of redirected us to some of the other resources where we could, get proper PPE outfits. But lately too, I actually reached out to our county health department, and I was able to secure some PPE equipment from them as well. So that's one thing I would encourage. At first, I'm like, well, I don't think they'll give me any, because I'm not treating exclusively patients that fit that demographic. But no, they were like, hey, we can give you some stuff. and help you out. So that was a really, really big help to be able to get help from our local public health department.
Rico, I remember when you had that eye injury. It was pretty tough on you, uh, but nobody knows your story better than you. Tell us what happened.
Yeah, so the eye injury, September the 28th, I never forget, I was at a water park with my family on, we had fall break, and they decided to go to a water park. Last day for the pools to be open in Georgia. And so I'm not a big thrill seeker, but my wife and my kids are. Say, hey, let's just get on this water slide. And I'm like, okay, is it steep? I looked up, I'm like, man, that thing is pretty steep. But hey, you know what? I got two girls and my wife. Can't chicken out in front of them. I got to do this thing. So I walked up the steep. It wasn't even stairs. It was kind of like a walkway as you walk up. And I'm like, all right, I can see the whole fun park. And I'm like, all right, we're going to do this. And then there was a kid behind me. She was probably maybe about 10, and she was terrified. I'd never ridden a water slide before. And I'm like, hey, you're going to be fine. I got to toughen up for the young girl, and no problem. So I was going down the slide, and I don't know if I just got too much momentum, and I actually hydroplaned on the slide, and I thought I was going to fall off the slide. So I was holding my nose because I didn't know if I was going to fall off the slide or go into some water, so the water don't go up my nose. But it ended up crashing into the other part of the slide, and my right thumb slipped off my nose and went through my left eyeball and almost pretty much knocked it out. So I was blind for a while. They had to activate the EMS. They had to, they were actually looking for my eyeball because they thought it was out because I had my hand over my eye and my face, and my blood was going everywhere. So they had me to open my eye, and it was still in there, but it was severely damaged. So I ended up going to the ER, and they were able to kind of stabilize me, but they didn't have anyone that can do that kind of surgery. So the next day, I ended up going to an ophthalmologist's office, and he assessed me. He's like, man, that's a lot of damage there. We really can't do anything until all the swelling and inflammation go down, and we can reevaluate you. So it took about a week or 2 weeks for the swelling and everything to go down, I went back, and he was like, man, yeah, this is too bad. I can't do anything for you. We got to try to find you, a surgeon that can work on your eye, that know what they're doing. So at that point, I'm calling around the country, trying to figure out where do I go. Do I come to Boston? Do I go to LA? Do I go to Miami? Do I go to New York? End up finding this pediatric surgeon that actually specialized in adult eye injuries here in Georgia. And I got an appointment with him, and I was just very blessed because this guy is usually booked up 6 months. And I knew somebody, and he took a liking to me, and he was like, hey, this is my buddy. He's an endodontist. He's in bad shape. Can you take a look at him? So he took a look at me, and he's like, yeah, it's some bad. It looks pretty bad. But I don't like to operate on these kind of injuries until at least 6 months. And I was like, well, 6 months, I'm going to pretty much lose my practice, lose everything. I don't have an associate. My bills are still coming in, and I can't wait 6 months. So I talked him down. He said, all right, let's give it 6 weeks. And then if it doesn't improve, I'll go in, we can go in and do surgery. So 6 weeks came by. I did not improve at all. So we went in and did a surgery on my eye. And then after that surgery, I had to wait 3 or 4 months until my eye and brain and my other eye start working together and connecting. And so when things start connecting, I went back, and he was like, hey, you're looking pretty good. I think you'll be able to get back to practice. So he was just like, hey, just get a microscope, look on your microscope, cut on some bananas and some apples, some oranges, and then maybe start doing some extracted teeth and then go from there. So that's what I did. And, it felt like going to dental school all over again. I'm like, this is crazy.
How is
So,
it now? Is it recovered?
say what now?
Is it recovered?
Yeah. So my first my first procedure, I had one of my best friends. He actually chipped number 8 and number 9. So I'm like, well, I can't really jack this up. If I do, he'll just have to go to the regular dentist. So I was able to do some composite repair work, and everything went pretty good. Get my hand-eye coordination back, And then I said, hey, you know what? I did extracted tooth. I felt pretty good. I said, I'm going to start. So my first day, I only saw two patients. I saw one person in the morning and one in the afternoon. And everything went really well. It was just very slow. It took me like double or triple amount of time to do it. I was sweating bullets because, hand-eye coordination, all that stuff has to work in sync. And then eventually things started kind of, it's like muscle memory. Things start kind of coming back. And now it's been since March the 2nd. And now, I haven't really missed a beat. My eyes, the focus and everything is there, and I feel like nothing ever happened. So it's
Thank
been
God, right?
a very blessing. Yeah. And in the meantime, while I was going through the recovery, I was trying to do something to express my feelings and everything. So I started writing my feelings down in a journal, and that journal ended up turning into a book. And it's doing really well on Amazon. It's called In the Eye of a Storm, 45 Days of Turbulence and Peace. And I kind of talk about my story in the book, but also give a lot of encouragement through life storms that we all will face. I mean, you'll face some storms. I know that you had some health challenges before, and you said, hey, you know what? I'm not going to let them just run me through the medical meal. I'm going to, put up my own defense and, take care of myself so I don't have to do what everybody else has to do in the condition that you have. And so the book just, it's a lot of inspiration, and this is inspire you to motivate you that no matter whatever kind of storm you face in life, you can get through it. It may be turbulence, but if you have an inner peace and a willing not to give up, you can make it through it. So that's what the really book is about.
Rico, you preach a lot, and I've seen a lot of pictures that you posted about your past. Okay? And it's great. We have the dental profession really has a spectrum of people with all sorts of different talents. And I've had some pretty bad days where I've listened to your preaching, and it's made a difference for me personally. Tell me a little bit. Were you destined to be the wonderful, amazing endodontist that you are today? Were you privileged? Were you given something special that nobody else had? Tell us your story. How did you become an endodontist? What was your journey to dental?
Well. First of all, I hate the word preacher, man. That's like what? Like I mean, I've met so many crooked preachers. I don't even like to be in that category. I like teacher, inspirational person, those kind of things. But preacher puts me behind a pulpit and makes me feel like I'm trying to get your money. So I'm not that. I just like to
I'm
give.
glad I didn't get any of my money, Rico.
Yeah. By the way, click that button and send me a offering. But no, I just I mean, because of so much stuff that I've been through, I know my faith has gotten me through so many things that a lot of people would have quit, a lot of people would have given up, or a lot of people would have just went a totally different direction. So how I got into dentistry in general was because as a kid, I was raised by a single parent mother, and she worked a textile job in the South. If you work a textile job in a mill, you've kind of made it, so to speak. So that's what she did. And we didn't have good dental insurance. So I eat a lot of candy, and I did not take care of my teeth at all. I remember at age 7, I had to get all 6 of my front teeth. No, I'm sorry, 5. Had to get all 6 of my front teeth, primary teeth, pulled because it was just full of cavities. And I remember what it felt like to have a toothache and all those kind of things. And I remember having to go to the dentist all the time. So by the time I got to high school, I like math and science. I wasn't sure what I was going to do, but ended up having a mentor who was a dentist, and he kind of steered me going into the right direction and say, hey, you know what, you can go into medicine and all these things, but dentistry has been very good to me. And he was the first black doctor I ever met. He was a black dentist, so that really impacted me a whole lot. So and I tell people all the time, I had the motor, but I didn't have the steering wheel. So he was the steering wheel, and I want to encourage you to find a mentor. And if you are somebody who's made it, if you're a dentist, I mean, there's a lot of kids out there that need mentorship, who may not look like you, may not think like you, but you can make a huge difference in their lives. like someone did for me. So I had I went to a historically black college university, aka HBCU, called Morris Brown College. And when I was there, I was surrounded by a whole bunch of other smart black people. Now, where I came from, I was the only, smart person, quote unquote, in my community, and going to Atlanta, where the Atlanta University Center, which consists of Morehouse, Spelman, Morris Brown, and Clark. I'm like, man, this is a mecca of a whole bunch of smart black people. So I really got to buckle down and shine. And so I worked hard there. I got accepted into dental school after 3 years. Um, and I went through a whole lot of stuff there. I was the only African American male, so I experienced racism. I experienced just people just not trusting me because of the color of my skin. Just a lot of things I had to endure through there, and made it out. And that when I finished dental school, I said, I'm done with school. I'm done. I'm done. I mean, this was too hard, mentally, physically, emotionally, and all the other stuff I had to endure that my other Caucasian colleagues didn't have to endure. I'm done. So I went back and practiced general dentistry for like 2 years. Things didn't quite work out with my mentor, and I went to go and visit a friend of mine who was in a endodontic program at Nova Southeastern. He tricked me in coming to the clinic, and I'm like, dude, I want to go to South Beach and check out the chicks. I'm 25 years old. Why am I in a freaking clinic watching you do a root canal under a microscope, which was kind of cool. And so the program director came by, and he saw me assisting him, and my friend introduced me. He said, "Oh yeah, this is Dr. Short. He took off time because he wants to be an endodontist." And I'm like, "What the heck?" And he just said, "Just go with it." So I just like, "All right, I'm gonna go with it." So anyway, make a long story short, I went back to where I was, and things weren't working out. My buddy was like, "Hey man, you just need to apply to endo and see what happens." And I'm like, "Man, you know what happened to me in dental school? I had a hard time, and I don't want anyone else to have their knee on my neck, no pun intended, again, you know." And so he was just like, "No, it's different here. It's different. You're already a doctor, so it's gonna be different from being a dental student." So I was like, "All right, it's Tuesday. When is the application deadline?" He says Friday. So I'm like, "Great." So I scrambled, got all the stuff in, and I sent it in. I got an interview, did the interview. Interview went well. They sent me a letter, say, "Hey, thank you for coming, but you did not get accepted." So I said, "Okay, well, obviously it wasn't meant to be." And I started practicing general dentistry where I was, and then end up getting a part-time gig at the health department. Um, so anyway, about 2 weeks later, I got a phone call at the office, and it was the program director at Nova Southeastern. He was just like, "You know what? There's something about you that I like. I want to give you an opportunity." He said, "Normally we only take 4 residents. I want you to be the 5th one." I'm like, "What?" Man, I could not pack my stuff quick enough. And I was so excited. And at the time, I don't know if I was more excited about being on South Beach or going to Endo at Nova Southeastern. Probably a combination of both. Being 25 years old and single, in South Florida, that wasn't a bad gig either way around. So I took the opportunity, man, and um, Endo was really different. Starting over is like they wanted you to throw everything you knew about root canals out the window and start over, and that was kind of different because we had to really learn it from a biological and evidence-based way. Everything you did, you had to justify based in literature and quote research and all this stuff. So it was just a totally different vibe. And so anyway, ended up finishing there, and my program director, he said, why I picked you? I was like, "No, why did you pick me?" He said, "It wasn't because you were black." He said, "You had passion, and I can look in your eyes and tell that you wanted to learn." He said, "I know you were young and kind of immature at the time, and that's okay, but I knew that you were going to one day make me proud." And he was like, "And you've done it." And so I ended up promising him I was going to become board certified. And I said, "Look, I know I look different from all these other guys here, but I'm going to stand out one day." And, this is almost since 2002. So you're talking about what, 18 years ago. And he is actually the program director at West Virginia now. He was just like, "Man, every time I look up, somebody asks me, 'Do you know this Dr. Short guy?' Or man, he's on the cover of this magazine, he's doing this. And he was like, yes, yes, I brought him in. He's one of the best students I've ever had. You know, and so to go full circle to